something else to consider when we have low back pain is that all of the time our upper back gets super duper stiff because we're moving way too much down through here in this part and we're not moving nearly enough up in our upper back. So we're getting a little bit of overcompensation. So we are just going to go over a few exercises that target thoracic mobility, so that middle back and that rib cage, just to help get that moving a little bit better. So the first thing that we can do is that we're going to just do some foam roller thoracic extensions. So the patient is going to place his middle back, right on top of that foam roller right there. Knees are going to be bent up like this. Hands go behind the head for support. And then we're going to want him to maintain some sort of contraction in his abs, so we're not getting a whole lot of low back movement here. And we're just getting him to arch that middle back right over top of that foam roller about as far as he can. Great, and then comes back up. We want to time this with the breath, so as you go back, you're taking a big exhale to really get as much movement through there as possible. And then we just do these repetitively, typically in sets of 10, to really just help get some of that mobility in through the thoracic spine and rib cage there. Another one that we can do that's really good is called open books. So patient's going to lay on their side. Yep, his top leg is going to come over at about 90-90 right on top of this foam roller. We really want to keep that knee pushed onto that foam roller there so that, again, we're not getting any movement through the low back. It's really all targeted towards the upper back. Then with this arm, we're going to open up all the way behind us and really feeling that in through that thoracic spine. And this one we can also time with our breath. So as we open up with our arm, we're doing that big exhale to really make sure we're getting the most mobility out of that as possible. And then as you can see, his head is also following his arm as well, so that we're not just kind of leaving that behind.